evening and welcome to Channel 23 News. I'm Faith Asbury, bringing you a breaking and troubling story here out at PHSC Memorial Hospital. A medication error involving a powerful narcotic resulting in the death of a young patient. Here to provide insight is the hospital's CNO, Kylie Aguiar.
Thank you for having me, Faith. This is such a troubling, hard time for all parties involved. This truly is a horrible case.
It really is, Kylie, it really is. I appreciate you coming to share this medication error with us.
Thank you.
So to begin, what constitutes a medication error?
So a medication error, as described by the National Library of Medicine, is any failure in the treatment plan that can cause or lead to harm in patient safety.
Okay. So who is most responsible for maintaining safe medication administration?
Safe medication administration is a teamwork process. It has to do with a doctor, the pharmacist, and the nurse. But the nurse is responsible for the last medication checks right before the patient receives that medication.
Okay, I see. What are the 7 rights of medication?
The 7 rights of medication are the right patient, right medication, right dose, right route, right time, right indication, and right documentation.
And what's the importance for this?
The medication rights are really important. They are non-negotiable for providing patient care and safely administering these medications. They confirm that everything is correct before you give that medication to the patient.
Okay. What are the potential risks of medication errors?
The potential risk of medication errors include understaffing, lack of education or training, and not following these medication rights or performing the 3 medication checks as you should.
Okay, are those the most important thing?
Yes, they are incredibly important in ensuring that the patient safely receives that medication.
Gotcha, okay. What are the roles of nurses in prevention of medication errors?
The nurses have an extremely important role in preventing medication errors. They are the last person the medication goes through before it is given to the patient. Some of their roles include verifying that it is the correct patient, route, dose, just with the 7 medication rights, confirming the doctor's order, having a second nurse check, performing dosage calculations, educating the patient. They really have a crucial role in making sure the medication is safely administered.
Well said, well said.
Thank you.
What are some medication error risk reduction strategies that could be implemented to avoid these situations?
That's a good question. Some medication reduction strategies we have implemented are nurses using the 3 medication checks, re-educating them on this, and making sure that they do have a second nurse there to waste high-risk medications or perform those dosage checks. We also make sure that they are scanning the patient's wristband and the medications each time, and a message will pop up to confirm, if that's right or if it isn't right. And we also have changed the medications for look-alike, sound-alike medications to be a different color or bolded, so that way it's a lot easier to recognize that they are different medications and not confuse them.
Okay. What is the procedure when a medication error occurs?
When a medication error occurs, the first thing you have to do is assess that patient. You want to make sure that they are completely stable and that the medication isn't already having an adverse reaction, if any at all. The next step you can do once you realize that the patient is okay, you can go ahead and report that to your superiors. And after reporting it, you will have to fill out a form about what happened. You should be completely honest about what happened. Everything that happened leading up to it, how you realized it was wrong, it all needs to be written down. After that, you most likely will have an interview done with your supervisor. Someone else in the hospital will come and talk to you about it, and you do have to let the patient know of your mistake and what happened. It's good to apologize.
Yeah, I'm sure it is. Tell me what the hospital does for the caregiver who has made this mistake.
The hospital really focuses on accountability and re-educating the nurse who has made this mistake. We do believe that it is a traumatic event for the nurse involved as well. And we want to re-educate them and provide them with counseling and an opportunity to talk about what happened and express their feelings.
All right, so we're going to be moving on to this troubling story of unfortunate events. Could you just tell me a little bit more about the story and the patient that was involved in this?
Of course. So the patient involved with this, her name was Josie King. She was 18 months old when she was brought to our hospital suffering from second-degree burns. She accidentally turned on the bath water and climbed into the bathtub with boiling hot water. She was doing fine at our hospital, healing well as expected, when things took a turn of events and she started to behave differently. Her mother was very concerned. She started to scream for water and try to drink the water she was being bathed with. The nurse told the mother that this was expected behavior and that children do behave like this sometimes, and that her daughter wasn't acting in a strange way or had strange vital signs that indicated anything was wrong. So they told her mother not to worry and to go home, when unfortunately when her mother did come back to the hospital, Josie was acting very strange, and her mother knew right off the bat that the doctor needed to see her daughter. And when the doctor arrived, he did agree with the mother that something was wrong with Josie and that she needed to receive 2 shots of Narcan because it appeared that she was having a reaction from the opioid medication she was being given.
Okay, so tell me a little bit more about this medication. What kind of medication was it that she received?
Josie received methadone. It is a narcotic and opioid painkiller. It also has to do with opioid dependency. It can cause respiratory failure and cardiac failure, which did unfortunately occur with Josie.
Okay. What type of harm did it do to poor little Josie?
It stopped Josie's heart, and she had to be put on life support. And eventually she was taken off life support and deemed dead.
Such an unfortunate event.
It truly is.
And why was this medication pass classified as an error?
So this medication pass was classified as an error because the doctor did give verbal orders to stop all narcotics being given to Josie. However, a nurse did administer methadone to Josie even after her mother had said, hey, the doctor said not to do this, are we sure? The nurse had claimed that the doctor's orders were reinstated to give Josie the methadone.
Okay. How did this error occur, and can you describe the chain of events in a little bit more detail? I know you explained a little in detail before, but go more in detail of more of the medication error.
Okay. So Josie, when she was moved down to the second unit, the nurses, like I had previously said, they kind of didn't listen to the mother's concerns about her daughter expressing such strange behaviors for her.
Okay.
They didn't notice that Josie was actually suffering from dehydration, and that's why she was screaming for the water and drinking the bath water. She truly was dehydrated, and they failed to recognize that. And the doctor did confirm that there was verbal orders that no narcotics should be given to Josie King. However, the nurse that administered the methadone did not confirm beforehand that the verbal orders to stop the medication were still in order. That being said, she did give the methadone at around 1 p.m. A little bit after that, Josie's heart did stop.
And how could the nurse ensure patient safety before and or after the error occurred?
The nurse could ensure patient safety by double checking that the doctor's order was or was not still active. She also could have listened to the mother's concerns about Josie acting strange and maybe she would have realized sooner that Josie was indeed dehydrated, and her dehydration certainly did impact the way the medication affected her.
Wow, what a story. Thank you so much for sharing this medication error with us and to the world, of course, so that we can just raise awareness about medication errors and really know what is a medication error,
Exactly. That's exactly what my goal was. I do want to get out how we can prevent medication errors and what you should do if a medication error were to happen, how to support the staff. It's a really important topic.
Thank you so much for joining us, Kylie. Like, this is amazing. Just
Thank you for
spreading-
having me.
You're so very welcome. Thank you. And before we conclude this interview today, we are going to have a special message from the State Board of Nursing right now.
This heartbreaking case reminds us why safe medication practices are essential in nursing. Medication errors can cause severe harm, disability, and even death. As students and future nurses, remember the 7 rights. Trust your clinical judgment and always speak up when something feels wrong. Preventing harm begins with you. Let's learn from this error and let's commit to excellence in patient care.